Hello, I am Monica Baluyot of BSN 3C of Group 9, and I will perform an inserting of nasogastric tube. The main purpose of this procedure is to provide nutrition to the client. So here is the procedure. First, we have to verify the medical order for insertion of an NGT tube. Perform hand hygiene and put on PPE if indicated to prevent contamination. Identify the patient. Explain the procedure to the patient and provide the rationale as to why the tube is needed. Discuss associated comforts that may be experienced and possible interventions that may allay this discomfort. Answer any questions as needed for them to cooperate during the procedure. Gather equipment, including selection of the appropriate NGT tube. Close the patient's bedside curtain or door for privacy. Raise bed to a comfortable working position, usually elbow height of the caregiver. Assist the patient to high Fowler's position or elevate the head of the bed 45 degrees if the patient is unable to maintain upright position. Drape chest with bath towel or disposable pad. Have NSS basin and tissues handy. Measure the distance to insert tube by placing tip of tube at patient's nostril and extending the tip of earlobe and then the tip of xiphoid process. Mark tube with an edible marker. Put on gloves, lubricate tip of tube at least 2 to 4 centimeters with water-soluble lubricant. Apply topical anesthetic to nostril and oropharynx as appropriate. After selecting the appropriate nostril, ask the patient to slightly flex head back against the pillow and gently insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. Patient may gag when tube reaches pharynx and provide tissues for clearing or watering of eyes. Offer comfort and reassurance to the patient. When pharynx is reached, instruct patient to touch chin to chest. Encourage patient to sip water through a straw or swallow even if no fluids are permitted. Advance tube in downward and backward direction when patient swallows. Stop when patient breathes. If gagging and coughing persist, stop advancing the tube and check placement of tube with tongue blade and flashlight. If tube is curved, straighten the tube and attempt to advance again. Keep advancing tube until pen marking is reached. Do not use force. Rotate tube if it meets resistance. Discontinue procedure and remove tube if there are signs of distress, such as gasping, coughing, cyanosis, and inability to speak or hum. Secure the tube loosely to the nose or cheek until it is determined that the tube is in the patient's stomach. Attach syringe to end of tube and aspirate a small amount of stomach contents. Measure the pH of aspirate fluid using a pH paper or a meter. Place a drop of gastric secretions onto pH paper or place a small amount in a plastic cup and dip the pH paper into it. Within 30 seconds, compare the color on the paper with the chart supplied by the manufacturer. Visualize aspirate contents, checking for color and consistency. Obtain radiograph or X-ray of placement of tube based on facility, policy, and ordered by physician. Apply skin barrier to tip and end of nose and allow to dry. Remove gloves and secure tube with a commercially prepared device, or tape the patient's nose to secure with tape. Cut a 4-piece of tape and split bottom 2, or use package nose tape for NG tubes. Place and split end over bridge of patient's nose. Wrap split ends under tubing and up and over onto nose. Be careful not to pull tube too tightly against nose. Put on gloves, clamp tube, and remove the syringe. Cup the tube or attach tube to suction according to the medical orders. Measure length of exposed tube. Reinforce marking on tube at nostril with an edible ink, and ask the patient to turn their head to the side opposite the nostril the tube is inserted. Secure tube to patient's gown by using rubber band or tape and safety pin. For additional support, tube can be taped onto patient's cheek using a piece of tape. If a double lumen tube is used, secured vent above stomach level and attached at the shoulder level. Assist with or provide oral hygiene at 2 to 4 hours intervals. Lubricate the lips generously and clean layers and lubricate as needed. Offer analgesic throat lozenges or anesthetic spray for throat irritation if needed. Remove equipment and return patient to a position of comfort. Remove plugs, raise side rail of lower bed, and remove additional PPE if used. And lastly, perform hand hygiene.
Hello po, Nay. Magandang umaga po. Ako po si Nurse Monica, ang nurse niyo po ngayong araw. Nay, pwede ko po malaman ang pangalan ninyo?
Maria Buena po.
Nay Maria, tanungin ko po kung kailan po kayo pinanganak.
June 1, 1981 po.
Okay po, confirmed. Nay, ayon po kay Dr. Baluyot, nagbigay po siya ng order na magpa-perform po ako sa inyo ng NGT or nasogastric tube. Kung saan ito po yung pagpasok po ng tubo sa ilong ninyo papunta sa tiyan nyo po. So, since hindi po kayo makakain ng maayos, dito po padadaanin yung mga pagkain na ipapakain sa inyo.
Nurse, masakit po ba yan?
Opo, may mararamdaman po kayong discomfort, pero at the same time, makakatulong to para mabigyan kayo ng tamang sustansya para may panlaban po kayo sa sakit. Nay, i-assist ko lang po kayo. Ay, linisan ko lang po yung ilong ninyo. Sa kabila po, Nay. Nay, tatakpan ko po yung isa yung ilong. Papakiramdaman ko po yung hangin. Dito naman po sa kabila. Pasok na po ako ng tubo. Kalma lang po kayo. Nay, inom po kayong tubig. Lunok po. May lumabas na pong yellow. Balik.
For feeding. First, we have to assemble equipment, check amount, concentration, type, and frequency of tube feeding on patient's chart. Check expiration date of formula. Perform hand hygiene and put on PPE if indicated. Identify the patient, explain the procedure to the patient and why this intervention is needed, and answer any questions as needed. Assemble equipment on overbed table within reach. Close the patient's bedside curtain or door. Raise bed to a comfortable working position, usually elbow height of the caregiver. Perform key abdominal assessment as described above. Position patient with head of bed elevated at least 30 to 45 degrees or as near normal position for eating as possible. Put on gloves and pin tube for the patient's gown and verify the position of the marking on the tube at the nostril. Measure the length of exposed tube and compare with the documented length. Attach syringe to end of tube and aspirate. Check the pH as described. Visualize aspirate contents, checking for color and consistency. If it is not possible to aspirate contents, assessments to check placement are inconclusive. The exposed tube length has changed, or there are any other indications that the tube is not in place, check placement by X-ray. After multiple steps have been taken to ensure that the feeding tube is dislocated in the stomach or small intestine, aspirate all gastric contents with a syringe and measure to check for the residual amount of feeding in the stomach. Return the residual based on facility policy and proceed with feeding if amount of residual does not exceed agency policy or the limit indicated in the medical record. Flush tube with 30 ml of water for irrigation. Disconnect syringe from tubing and cup end of the tubing while preparing the formula feeding equipment. Then remove gloves. Put on gloves before preparing, assembling, and handling any part of the feeding system. Administer feeding when using a feeding bag. When using a feeding bag, label bag and or tubing with date and time. Hang bag on IV pole and adjust to about 12 above the stomach by clamp tubing. Check the expiration date of the formula. Cleanse top of feeding container with a disinfectant before opening it. Pour formula in the feeding bag and allow solution to run through tubing to close clamp. Attach feeding setup to feeding tube and open clamp and regulate drip according to the medical order or allow feeding to run in over 30 minutes. Add 30 to 60 ml of water for irrigation to feeding bag when feeding is almost completed and allow it to run through the tube. Clamp tubing immediately after water has been installed. Disconnect feeding setup from feeding tube, clamp tube and cover end with the clamp. When using a large syringe, remove plunger from 30 or 60 ml syringe. Attach syringe for feeding tube. Pour pre-measured amount of tube feeding formula into syringe, open clamp, and allow food to enter tube. Regulate rate fast or slow by height of the syringe. Do not push formula with syringe plunger. Add 30 to 60 ml of water for irrigation to syringe when feeding is almost completed, and allow it to run through the tube. When syringe is emptied, hold syringe high and disconnect from tube. Clamp tube and cover end with cup. When using an internal feeding pump, close flow regulator clamp on tubing and fill feeding bag with prescribed formula. Amount used depends on agency policy. Place label on container with patient's name, date, and time when the feeding was hung. Hang feeding container on IV pole. Allow solution to flow through tubing and connect the feeding pump following manufacturer's direction. Then set plate. Maintain the patient in the upright position throughout the feeding. If the patient needs to temporarily lie flat, the feeding should be paused. The feeding may be resumed after the patient's position has been changed back to at least 30 to 45 degrees. Check placement of tube and gastric residual every 4 to 6 hours. Observe the patient's response during and after tube feeding and assess abdomen at least once a shift. Have patient remain in upright position for at least 1 hour after feeding. Remove equipment and return patient to a position of discomfort. Remove gloves, raise side rail, and lower bed. Put on gloves, wash and clean equipment or replace according to agency policy, then remove gloves. remove additional PPE if used, and lastly, perform hand hygiene.
Hello po, Nay. Magandang umaga po. Nay, ako po si Nurse Monica. Ang nurse po ngayong araw. Nay, tanungin ko po kung ano pong pangalan nyo.
Ako po si Maria Buena,
Nay Maria, kailan po ang birthday nyo?
June 1, 1981 po.
Okay, Nay. Nay, may order na po si Doc. Papakainin ko na po kayo ng almusal ninyo. Nay, magpasok pa ako ng 30 to 60 ml na tubig.
And now I will perform a removing of NG tube. First of all, we have to check medical order for removal of NGT tube, perform hand hygiene and put on PPE if indicated, identify the patient, explain the procedure to the patient and why this intervention is warranted, describe that it will entail a quick few moments of discomfort, and also perform key abdominal assessment. Pull the patient's bedside curtain, raise the bed to a comfortable working position, usually elbow height of the caregiver. Assist the patient into a 30 to 45 degree position. Place towel or disposable pad across patient's chest, then give tissues and NSS be sent to patient. Put on gloves, discontinue suction and separate tube from suction. Unpin tube from patient's gown and carefully remove adhesive tape from patient's nose. Check the placement and attach syringe and flush with 10 ml of water or normal saline solution, or clear with 30 to 50 ml of air. Then, after that, clamp tube with fingers by doubling tube on itself. Instruct patient to take a deep breath and hold it quickly and carefully remove tube while patient holds breath. Coil the tube in a disposable pad as removed from the patient. Dispose of tube per agency policy and remove gloves and place in bag. Perform hand hygiene. Offer mouth care to patient and facial tissue to blow nose. Lower the bed and assist the patient to a position of comfort as needed. Then remove the equipment and raise a side rail and lower bed. Then put on gloves and measure the amount of nasogastric drainage and the collection device and record an output flow record, subtracting aerated fluids if necessary, and solidifying agent to nasogastric drainage according to the hospital policy. And lastly, remove additional PPE if used, and perform hand hygiene.
Hello po, Nay. Magandang umaga po. Nay, ako po si Nurse Monica. Ang nurse po ngayong araw. Nay, tanungin ko po kung ano pong pangalan nyo.
Ako po si Maria Buena,
Nay Maria, kailan po ang birthday nyo?
June 1, 1981 po.
Okay, Nay. Okay. Nay, may order po si Doc na pwede na pong tanggalin yung tube sa inyo dahil makakakain na raw po kayo ng maayos.
Okay po.
Nay, hinga pong malalim.